As Michael said, I think our little demonstration here shows again it's not our brains that are the problem, it's the world that's gone mad. So let me take a moment and see if we can get this going.
It's PowerPoint.
It's PowerPoint, yes. PowerPoint causes cognitive decline. Not everyone's aware of that. Yes, my name's Henry Mahncke, and I'm the Vice President for Research and Outcomes at Posit Science Corporation. And we're a startup company in San Francisco that's developing scientifically based and clinically validated brain plasticity training programs. But I'm not here to talk about that stuff at all. I'm here because Nancy was kind enough to invite me to serve on an advisory panel around the ASA Metlife survey on attitudes and awareness of brain health. And this was a fantastically interesting and timely survey, and we're going to sort of step through the main points and some of the interesting deep dives of the data that has come out here. A lot of this is going to reinforce what my two colleagues have said so far, but in addition to that, there are a couple of very specific interesting insights that came out of this, and I think they're going to highlight some real opportunities for research in brain health, and as well as highlight some real risks about how public awareness of brain health may develop. Is this the right presentation, actually, Nancy?
Yeah, it is. It's just a...
Okay, great. So the main goal of this study was to gain insight into awareness around the new science of brain health, and particularly to get an understanding of what do people mean by brain fitness. How important do they really see it? You know, where are they getting their information, which I think is a very relevant question because there's so much folk wisdom out there around brain health. And then finally, well, what are people actually doing, given that a lot of people seem to be doing something? And this study interviewed about 1,000 people from the ages of 42 and older. So let's hit on the main findings. So first of all, what's interesting is that people are very optimistic about brain health, at least in this survey. So nearly 9 out of 10 people think that it's possible to improve brain fitness. And at least for me, this was actually quite a startling number. Because I think 10 years ago, if you had talked to most doctors, most neurologists or physicians, the notion that there was something you could do to change your brain health or brain fitness, people would have said, well, no. The brain is probably just sort of wearing out over time. And this number is particularly interesting to me because as a brain plasticity person, of course, we fundamentally believe that the brain is capable of change and improvement at any age. There's a huge amount of research to be done to figure out what the best way to do that is and what the real impact of that is on someone's life. But of course, we do think that the brain is capable of change in that way. So it's interesting to see that that notion of brain change has permeated the popular awareness. As a result, or perhaps associated with that, many people say that thinking ability should be checked routinely, just like a physical checkup. And that's a pretty interesting number as well because I personally spent a lot of time talking to primary care providers about this issue recently, and I'm sure many people in the audience have as well. The challenge, of course, that most primary care providers have in today's health system is that there's no time to talk about brain health or brain fitness. A doctor's perhaps spending 15 minutes or half an hour with someone, and as we saw from the slides previously in this presentation, they're going to talk about cancer and diabetes and heart health. And maybe if they're going to do anything mental, perhaps they're going to screen for depression or something like that. But the issues of ordinary age-related cognitive decline, or to flip that around, the issues of brain health, aren't coming up in those initial physician interactions. Now, people seem to want them to, but it's going to require a fair amount of change to the culture of that patient-physician interaction to have that happen. And then, of course, this survey reinforced, I think, what both folks here have mentioned so far, which is that nonetheless, brain health is a low priority compared to other things. People mention things like heart disease and cancer and so forth before they mention taking care of their brains as they age. Those issues have really permeated the popular awareness in a way that the brain hasn't yet. Second of all, this also exactly reinforces what Michael said. People think that they're okay right now. And what's interesting particularly is they think they're okay pretty much regardless of their age. And whether that's denial or whether that's perhaps the fact that most people are in a situation in which they have constructed it in such a way to maintain their function, one way or the other, they think they're doing okay. What I'd add to that based on other research that's been done is that although most people do think they're okay, most people also think their friends are maybe not okay.
Right.
So everyone knows that they don't really want to be like Mrs. Jones down the hall. She's someone who's really lost it over time. But probably everyone is that Mrs. Jones for someone. So there's an interesting disconnect here. Third of all, people do identify a lot of activities that they say are useful for maintaining mental fitness. And there's a couple interesting things about this list, tobacco, fruits and vegetables, puzzles, and so forth and so on. I'm very much of two minds about what this means, and I'm going to be quite interested to hear the discussion that comes out of this afterwards. On the one hand, you know what? Most of these things are a pretty good idea, right? We should stop smoking. Every one of us in this room, I'm sure, could eat more fruits and vegetables. I'd start with myself on that list. Limiting drinking, spending time with family and friends. These are all sort of mom and apple pie recommendations, and they may in fact be helpful. On the other hand, and I just want to start this discussion point rolling, well, there's not that much evidence that most of this is probably actually helpful in terms of brain health specifically. And, might just pick any one specific example here. I'll do puzzles. There's really never been a large-scale randomized controlled trial that says if you take people and have half of them do puzzles and the other half of them don't do puzzles, that the half that do puzzles have some sort of beneficial effect on their mental fitness. That work's just simply never been done. That's a piece of folk wisdom. So, again, you wouldn't hesitate to tell anyone they shouldn't do puzzles because they're cheap and they're probably fun. But the notion that this is in people's minds as something that they can do to maintain their brain fitness is interesting and perhaps even worrisome at the same time. And most people do self-identify as taking care of their brain health in some way, shape, or form, right? People think they're doing art and creative projects, they're keeping physically active, which of all these things is probably the one that's best validated as perhaps being helpful. Games and puzzles we see again, spending time with others. So people see themselves as thinking that this problem is important and see themselves doing something about it. Now, when we got to the part about what are sources of information about brain fitness, perhaps reassuringly, most people do suggest that going to talk to a doctor about brain fitness is a good idea. And again, that's almost certainly a good place to start. Interestingly, younger people more often choose the internet for brain health news. However, I think it's at the same time a bit of a reality that the doctor that they go to, their primary care provider, is often a person who him or herself may not be sort of super up to date on what really is known about how to maintain cognitive fitness and what really is known to work and what really doesn't. Most PCPs, again, are terribly overburdened with a fantastic number of things they have to keep up with. So although going to a doctor is probably a good first step, there's a tremendous amount of work that needs to be done out there with physician education, I think, around making sure that those frontline providers really know what recommendations they can make that have really been shown to be clinically validated. However, although people identify that talking to a doctor is a good idea about these things, many people report that they haven't really spoken with a doctor yet. And I think that's because a lot of those time issues that we've mentioned.